Today on The State of Us, the pandemic didn't unfold the way that one doctor expected. She finds her non-COVID patients have suffered the most in the overwhelmed healthcare system. Welcome to The State of Us. I'm your host, Justin T. Weller, joined, of course, today by the one and only friendly redneck liberal and senior resident historian here at True Chat, Mr. Lance L. Jackson. Today, we're looking at the untold side of the pandemic, which is all these people who don't have COVID that are suffering. And you might be scratching your head saying, what do you mean? Well, we're talking about the individuals with chronic diseases, addiction, mental illness, who are suffering as a result of a stressed healthcare system. So we're going to look at that, how one doctor's story informs this conversation, and we're going to have a unique look into what's happening in rural America in regards to COVID, because I had the opportunity just on Monday, so just a day or two before this recording, to speak with somebody that I know fairly well, which is our local health commissioner for the health district in Champaign County, and the president of our local hospital, which is the only one in the county. And we've talked a lot on this show, Lance, about rural healthcare. So I think it's a great opportunity to give a real world example of what are they seeing. The only hospital, right, in the entire county, the only emergency department in the entire county. What are they seeing and experiencing? And what is our local health commissioner saying about the state of COVID in our county and where it's going? So we'll get a look inside rural healthcare as it pertains to COVID, and talk about the untold effect on other patients as a result of COVID. But before we get into all that, Lance, we have a word of the day, I assume.
We do. The word of the day is excogitate. E-X-C-O-G-I-T-A-T-E. It is a transitive verb, excogitate, excogitated, or excogitating. It means to think out carefully and fully, or to contrive, devise, or invent by such thought. So we're going to have and share some excogitative thoughts with you today. And hopefully you will agree and you will send us your excogitative thoughts at podcast@thestateofus.org as we talk about rural healthcare and the pandemic. Because we hear all the time what's happening in New York City or in Florida or in LA, but what is the impact here in rural America? Not that the impact's not there in the big cities, but what's happening in our smaller towns and communities as well. So we're going to try to have some of those thoughts for you and share with you and think deeply on them and carefully and share them with you. And then we want to know how you feel about them as well. So where are we starting, Justin?
Well, I think we can count on our listeners to excogitate, right? They've proven that because we get those great comments. And as Lance mentioned, they can email those to podcast@thestateofus.org. So we do see the proof is in the pudding, right? They do in fact do that. So hopefully you'll do it today and share with us. If you're in a rural community or a big community, just what is your experience? Because I think that's what today is. We're not saying this is how it is everywhere, but we are wanting to try to share that example. So we've got several different things to cover, but you want to start, Lance, with Dr. Christine Hancock, or you want to talk about our local stuff first? What's got the juices flowing for the friendly redneck liberal today?
Well, the story got me started. And then when you shared with me this morning what happened at the local leadership meeting that you attended.
The highfalutin Rotary meeting of Rotary International, having a good conversation over lunch.
Yeah, I think that's more pertinent to what we're discussing today, because I think most of us have seen in the national media where they're talking about the shortage of hospital beds, and I'm sure your local areas like ours, and that is hospitals have since before Christmas said, that certain types of surgeries aren't going to be done now because there's not enough room. But I found it very interesting with what you said, our local health commissioner, as well as our local hospital administrator for our very small local hospital that's part of a regional and national chain, what they had to say just a couple of days ago. So I think if you want to go there, I think that's where we need to start. I think that's more pertinent to our listening audience, because they're probably keeping up with what's on their local news station or their regional news station, depending on where you live. I say because we don't have a local. Our local, is Dayton or Columbus. And so we don't have a local news channel.
So the background.
So what did you find out?
The background for folks who are not longtime listeners or who maybe don't remember is that Lance and I right now are recording from Urbana, Ohio. Okay, not Illinois, and we're
Maryland,
and we're in the county of Champaign. And I know that makes it extra confusing with Illinois, but it's Champaign County, Ohio, which, just so that you understand, is a county of about 40,000 people total in the whole county, and Urbana, the city, serves, and I say serves, not population, because the population is kind of a misnomer, serves about 25,000. So there's a lot, the majority of the people in the county probably use Urbana in some way. Urbana is also centered in the middle of the county, and it has the only emergency room in the county at our hospital, which is also the only hospital in the county. So, if you're going to the hospital, there's a good chance you're going there. You might be going to next door, Springfield, which is the nearest, they're a small town, but they're big in comparison to us. And they have what's called Springfield Regional Medical Center. And both of those institutions, our local hospital and that, are run by Mercy Health. So when Lance mentioned the administrator, she works specifically here at Urbana and oversees our hospital, but she works obviously very closely with Springfield because they're a full service hospital and we are a critical access hospital. So we're a small hospital. For example, we got 12 rooms right in the ER. And one of the things she was explaining, Lance, her thing was just I'm just going to tell you what we're experiencing. Of the 12 beds in the emergency department, they've got 5 of them that the majority of the time they're boarding patients in. And for those of you that aren't familiar, basically what that means is these are patients that they need to go somewhere else, right? They need to be transferred to Springfield, or they need to be sent to Columbus or to Dayton, but they cannot be because those hospitals cannot take them. They do not have room for them. So the only option is to leave them in the emergency department at Urbana. And you might say, well, why don't they transfer them up into the main hospital at Urbana? Well, one of 2 reasons. One, because we can't provide what they need at this hospital. So in other words, the only place that's qualified to take care of them in the hospital is the emergency department. They need a level of care that is not offered in the hospital side. So they can't be in residence at the hospital because they need to be transferred someplace else, right? So that's scenario number 1, why they might be getting boarded. Scenario number 2, which she was basically saying is the vast majority of what they're seeing is these patients have COVID. So the patients that are being boarded have COVID, and we can't transfer them up into the hospital because we don't have a COVID unit here. So we can't risk taking them up and mixing them with our population of hospital patients and getting them sick, because the hospitals that are set up, they have a dedicated area for COVID patients, special protocol in place to try to keep everybody safe. But we can't find anywhere that'll take them because everybody else is overflowing. Because
their COVID wings in the bigger hospitals are full at the moment.
Exactly.
So when I see on the news media, and they're talking to these hospital administrators in Branson, Missouri, or New York City, or in LA, and they're saying, yeah, we're just full. We don't have any beds available. This is the cost to the smaller hospitals in the rural communities, is they have people who need to get into those places for better care, but it's not available.
Right.
So, I mean, that's scary, right? So but that's reality. And I'm sure Urbana's not an outlier. I'm sure that there are smaller medical facilities all over the United States who are in the same boat. So we see the big hospitals and we say, oh, well, they're full. Okay. Well, but what that means is all of these smaller entities of medical care don't have anywhere to take their patients. And so they're having to be creative in order to keep them alive. And then it also then limits the amount of care that they can give to other people who come in to these smaller facilities. And I think it was interesting you pointed out too, that for our little tiny hospital and care, couple things. One, according to the statewide data, our emergency room is 3 times faster to be seen than the state average. It's an hour and a half around the state to wait to be seen. And I've heard people talk about the long lines on the news. And ours is just a half an hour. But also that our current, you've heard this one too. So, I mean, it's not just in your big cities, folks. That's our point, is it's across the medical community. This administrator also shared that she's losing 3 very qualified nurses by the end of January. And her nursing staff isn't that big. So you say, well, there's only 3. Well, that's a large percentage of their nursing staff. And 2 of them are out of their emergency room, which is right now, obviously front and center in receiving patients. So they're retiring because they're just tired of things, folks. Not because they're done, not because they don't like their job. They're just exhausted and they can't keep going to work. Those are the reasons that she shared with you. I found that astounding because you think, oh, this is small town America. There's not that much going on. Well, here's our local hospital who doesn't have that many nursing staff anyway. Losing 3 is huge, but it makes sense. But I don't think we stop and think about it. It's like, oh yeah, it's horrible in Philadelphia or New York City or LA. It's horrible in small America as well, even though it doesn't make the news.
Right. Well, because it's relative, right? You have 12 beds in your ER and 5 of the 12. So just shy of half, are spoken for.
Well, you say you don't have a COVID wing, but you do. It's in your emergency room.
Yeah. Which is not where you want it to be.
Does that mean, I'm not really smart here, but doesn't that mean that if I go to get treated in our emergency room, in all likelihood, I could be exposed, not exposed because I'm not within 6 feet or whatever, but that means COVID's in our emergency room.
Yeah. So they have had to retrofit rooms to have doors and be closed off, which is time and resources, right? And you're still not, the way they're doing it, they're doing the best they can, right?
Sure.
I mean, it's not like they're not trying, but it's also, they're trying to be very honest about, this is not, there's a right way and this isn't the right way. It's better than nothing, but there's a better way to do this. So we're having to try to do the best we can, because what else do we do? We can't, they're too sick to send home. They have to be at a hospital and there's nowhere else to send them. But then what that means is, and I think this is part of what we're going to talk about a little later in the show after we talk about health commissioner and stuff, is it means that then patients who come to the emergency room, right, on a busy Monday, because she said, this community loves to wait until Monday to come to the emergency department, but it's very possible that, every room is taken. And so you just have to wait until we can get somebody out of here. We can't send them to some other hospital because that hospital doesn't have room for the same reasons that we don't have room. So now what? She said this right now is, since the pandemic started, is the worst it's ever been. She said, just to be clear about how many people we're dealing with that are having these issues and how many people are, because they work very closely with Springfield Regional Medical Facility, because that's where they send many of their patients, because it is the closest full service hospital that's available. So it's the shortest, when we're going to transport you, it's the shortest place to send you. And it's the story of, they can't, what do you do when you can't take anybody else? I mean, sorry,
right.
I mean, you can wait in the waiting room, but like, what are we going to do? We don't have the staff. So it's not like we're going to set up beds in the waiting room, because we can't take care of the people that are already here, which is a crazy thing to even be thinking about, in the United States. I mean, that we're in a situation where you're having hospitals that are facing that, because at Springfield, and she talked about this, they have beds in the hallway in the emergency department. That's what they've had to go to.
The only thing I can imagine is when I watch a war movie and you're in triage and you just get so many soldiers coming in at once that need care, you just put them anywhere to treat them, is what it's starting to sound like.
So we'll let people excogitate on that, but we've got more to talk about. What else do we know about the state in rural America of what's going on? Again, just here in Champaign County, in the great city of Urbana, Ohio. What's our health commissioner saying about what's happening? How many people we got vaccinated? How many people aren't vaccinated? And how does that compare to everybody else? Well, to find out, keep it here on The State of Us. We'll be right back. We hear about COVID in New York City and all these places and how bad it is and the things they're facing. But I think it's really important to take a look at small towns and understand what's going on there too. I think we've tried to do that on this program over the many years, is to make sure that people are getting that rural America perspective. And one thing that I think is important to understand about, again, it doesn't sound like big potatoes because we're saying, well, we got 12 rooms in our emergency department at Mercy Health Urbana Hospital. But our hospital is, Lance, it's what's called a critical access hospital. Okay. And that's a program that the United States federal government established in 1997 as part of the Balanced Budget Act. And the program's purpose is to offer small hospitals in rural areas to serve residents that would otherwise be a long distance from emergency care. And that's basically to say, right, that part of the reason that our hospital is important is because if you're really, if you need emergency care, depending on where you live in the county, you may very well be an hour from a place that can offer you that care, and, again, if any of you have been in that situation with a loved one, you would know that in some cases, an hour is way too much, sometimes 20 minutes is too much.
Well, I'm 30 to 45 minutes away from what most people would consider a normal care facility if you take away the local hospital. And that's if I'm driving really fast and there's no traffic.
Right. No issues.
It could be an hour and 15 minutes. And so to that point, you say, well, what do you do if you need to get there quickly? Well, we have a helicopter system, right?
Yeah.
Where even though we're, in a county, in a city, of 25,000 people and a county of 40,000, if it's an emergency, if it's, really life-threatening, we have to be transported by helicopter to get somewhere. But the point is here with the COVID, as we're doing this show, the numbers today were twice as many people dead yesterday as there were a year ago at this time. Twice as many infections as there were a year ago this time. And that's with a vaccine. So, and it's not just, well, more people are getting sick, but they're not, they're not dying. No, folks, we know, right? I mean, when we stop and think, and we were talking about this off air, it's like when, you play with the blanket with the little baby, they're surprised every time you move the blanket and you're there. But people said, well, it's not that bad. It's not that bad. Okay. But we know that it comes in stages, right? First, everybody's exposed. Everybody gets sick. Then we see a rise in hospitalization, which is where we've been and where we are. And then we start to see more deaths, which is what's starting to happen. Every time that's what happens. But everybody starts out with, oh, it's not that bad. And now we have people who have been vaccinated, myself included, coming up on a year since I got my first vaccine. And yet we're seeing more people dying as of yesterday when we're recording this show than we did last year at this same time.
Neither of these people shared this information publicly, okay? And I'm reciting it to the best of my knowledge. But any error in this data is not an error on their part. It's me probably not relaying it correctly, okay? So I think we've gotten everything pretty close, but obviously if you look into this stuff and you find out that, it's 13 beds and not 12, I know it's 12, but just as an example, it's not that we have a bad hospital administrator, it's that Justin didn't remember it exactly.
So yeah, we're telling you what's happening here, but hopefully it makes you get out and make the phone call or the contact, the email to find out what's going on in your local area at your local hospital or your regional medical center, so you know what to do when you're faced with the medical crisis in your life. So you're not going and finding out, oh yeah, we don't have any room at the inn for you here.
The last point on the hospital one was that the Springfield Regional Medical Facility, I believe it was about 40 people that she said are there, all the time with COVID, where they're sick enough they have to be hospitalized. But the big point was, which kind of transitions into what the health commissioner was saying, is 85% of those people, no less than 85%, are unvaccinated. And anecdotally speaking, the only people that have died, locally are the unvaccinated ones. So there are some people that have gotten sick who have been vaccinated, but they've not died as a result of it. So this top number has not really changed that much. 44% of Champaign County has been vaccinated, has started their vaccination process. A piece of positive news, because that doesn't sound very positive, in that we have less than half of our people that have been vaccinated. But it was just a couple months ago when Lance and I looked at this information that I think it was only like 15 or 20% of people were fully vaccinated. Now it's 44% have started their vaccine process and 43% are fully vaccinated. So the one piece of positive news is the people that have chosen to get vaccinated now by far and away are fully vaccinated. There's a infinite, and the feeling from the local commission is the people that are not, it's not because they don't think they should, it's because they just haven't gotten to that point yet of getting, they're not at the point where they're supposed to get their next shot or whatever it might be. The health commissioner made this big point. Two things that I thought really stood out. One was that's better than he's seeing with most other counties of the same size around the state, which is bad news, obviously. We're a good one, we're doing well.
With less than 50% of our population vaccinated.
Yeah, we're leading the charge of rural counties.
Well, that's like, and here's to my point, what I'm thinking here as we talk about this, is that I'm vaccinated and I have health concerns, but if I get sick somewhere else, some other way, right? I can't get service because these people didn't get vaccinated and they're taking up beds. So you say, well, I don't think I'm going to get sick. Okay. But then you do, and you're unvaccinated and you do, and now you're taking up a bed and now I have a heart attack and there's no place to put me, or I can't get the surgery, or I can't, or I have to. It's like, folks, when are we going to stop thinking about just ourselves and what we're doing to other people? It's like, okay, it's not just COVID now, right? It's not just whether or not you're going to get COVID and you're going to survive it. But now these patients, and I'm glad they're getting care, but they're stopping other people from getting care that need care, and not to get into, your dad, but your dad's got, quote, an elective surgery that's hurting his quality of life, and he can't get it because these people who chose not to get vaccinated are taking up space to the point where the hospital says, we can't do your elective surgery. And it's like, folks, you're affecting other people. You don't care? Really? Really? This is America where we don't care about how our actions affect others? When did we in America become this insensitive to the needs of others? That's what I've always thought was great about America, is that we reach out and help those in need. And now our selfishness is not allowing us to help others. The very simple fact, and I understand, boy, I'm opening up a can of worms. Send me, okay? Send me. You tell me how it's okay for you to be insensitive and stop the needs of others because you don't want to get the vaccine because of A, B, or C. Send me that email, please, because I want to read them, and I'll read them on the air because I think you're nuts.
Thankfully, right at this moment, at the time of recording, and this may change even by the time you all hear it, most hospitals, everywhere are still doing the quote unquote elective surgeries, but you're often having to wait substantially longer, and again, that point of elective surgery, I think it's a misnomer because it makes people think of things like, I want to get a nose job, that I don't need. Like, that's not really, yes, that technically would be an example of something, but that's not the majority of what's happening. To Lance's point, there's a ton of people that it's a quality of life. It's also a longevity thing of you need to have it done now because if it gets worse, it's going to be harder to fix. So even though a lot of those things are still taking place right now, we're having all these delays because, again, staffing shortages. We have healthcare people that are getting sick, right? And with the staffing shortage, we have this whole new program in most hospitals where we have all these people that have to take care of COVID patients who we didn't have to do that before. That wasn't something that we were spending any time on. So we're in the middle of a staffing shortage anyway, and we're having to allocate people to take care of people that, again, we would still have to have COVID units, but take Mercy Health, Springfield Regional Medical Center as the example, right? We got 40 people there. We would only have 15% of those 40 people who would still have to be there, which is a heck of a lot less. And I got no problem it's not, they've gotten the vaccine. They've tried.
That's 6 people instead of 40.
They've tried to do what they need to do. They need the care now because there's nothing else they can do without assistance. But then you got all these other people in there who, most of them, had the option of, you could have gotten the vaccine and probably not have been here at all if you had, So, but you're taking up time and resource that, again, you don't have to, so, or, right, fine, you don't want to get the vaccine, but then why should other people have to suffer because you need the hospital space? You don't want to get the vaccine, okay, but then don't come to the hospital and ask for help. It's the thing we talked about with insurance before, right? You don't have insurance, but then you show up and the hospital takes care of you, and then Lance and I are stuck paying for the bill because you didn't have a way to pay for it, So it's frustrating because there are people who are suffering as a result of this. And that's the whole point of the article, which we'll talk a little bit coming up. So a few more pieces from the health commissioner, and also a little bit about the this bigger issue that we've started to touch on of the people being affected who don't have COVID at all. Keep it here on The State of Us, and we'll be right back. Where do we go from here? What's next for COVID? Because I'm sure, it's a hard thing. Lance and I've talked about that. I know people are getting worn out. People on all sides of this, right, are getting worn out of talking about it, going through it. Everybody wants it to be over. We talked about that the last time we discussed this. Nobody wants COVID to be here, okay? Nobody thinks that COVID is a fun, good thing. That's where it's important to understand we are making decisions actively as a society that prolong this. Because the other thing the health commissioner said, the second thing I mentioned, the first one was the thing about vaccinated people and that we're in a good, quote unquote, good position relative to other counties our size across the state of Ohio, which we talked about. Sad that that's the truth, but it is. The second thing that really stood out, Lance, was he said, you hear some people talking about herd immunity and stuff and like where everything's going. And he said, just to be clear, we have the numbers, right, at the local health district. If you add the people that have gotten COVID in the county, and the people that have been vaccinated together, he said, in our county anyway, we're nowhere close. We're not close at all. Because he said, now we have more people getting sick than ever before. So he said, the next thing, and this is about the future of where we're going, he said, is what we're hearing internally is that, we're headed for possibly the biggest wave that there has been. But he said, which they're estimating is going to peak near the end of January, probably. The feeling is it will be the last big wave. And he said, and part of the reason why is because as a result of this, there's going to be so many people that will get sick that then we will be on this other side of what will probably happen. He said, if the developing variants stay the same, is we're going to see this downgraded from a class A disease to class B. And basically, he said what that means is class B means we're sort of accepting that this will always be here, that it's not going away. But he said that, it'll be like the flu or something like else that we manage in a similar fashion to those types of diseases where we have annual programs and that sort of thing. And hospitalization should, start to go down because you're going to have people that are vaccinated or people that have gotten sick, and he said the one positive thing is that we are seeing that, Omicron generally seems to be less lethal. It is very infectious, and he talked about, we actually have, and he used epidemiologist terms because he used to be an epidemiologist before he was our health commissioner. So he's familiar with this kind of stuff. So I'm not going to get the terms right, but basically he explained how we measure the infectiousness of a disease. And what he said was, just to put in perspective, he said, COVID is the new variant is more infectious than measles, right? And he said, and that's a class A, ultra infectious disease. But he said the other thing is that, we have this stuff where we have some things that are very infectious in this world that are not lethal. And he said, and there's lots of reasons for that. One is because some of them we've gotten under control totally with vaccines. Some of them are just not inherently very dangerous. You get through them. Like the common flu for most people is not a life-threatening illness, but that's kind of the, he said, I wish there was, something else to tell you other than the feeling is that we're going to shift thinking toward this is not something that's going away, it's going to be around, but that we're getting to the point where we understand what we have to do to manage it. And that hopefully, as the variants continue to develop, we're going to see less lethal variants, which will also change how it's managed. Well,
we haven't talked a lot about the article, but this, as we were discussing, this isn't one time on the show where we've talked about some other things, but you need to go read the article and, it's connected to you, and you can get in there and you can read it because there's a lot of anecdotal stories here that I think are heart-wrenching and make sense. And you probably know people in your community or in your church family or your personal life who have been affected this way. And I think it just opens our eyes. If not, then the article opens your eyes to what effect this has on the periphery that we don't see. This isn't an article about the number of people who are getting it, the number of people that are hospitalized, the number of people who are dying. It's not that kind of article. It's about this doctor who, since the start of the pandemic, has had trouble taking care of her chronic need patients, people on dialysis, people who have chronic illnesses that she used to see that they don't see now. And so, we were talking about it when we chose this article, that it was going to be tough to keep your attention. So I think it's one that not very rarely on the show do we have an article for you that we don't talk about. But in this case, I think it's one that you would benefit from more so by reading it yourself than it is for us to talk about it, because it's just amazing. This doctor who has been followed by this reporter for more than a year, sharing the ins and outs of daily trying to take care of their patient load.
Well, and I think the other thing is we did talk about, we spent the better part of the second segment talking about the theme of that, which is all of these people who are having to sacrifice their care, they don't have COVID, but their care is being sacrificed because of COVID. So, and that's what the article is about. But the reason that I think Lance and I feel so strongly that we hope you'll take time to read it is because we talked about this before the show. We didn't feel like there was a lot we could quote from the article and be fair to the piece, because it's well done, but it's a story, right? It's not just stats and info, because it's really not stats and info. It's more of these are real people and this is what has been happening. So we were able to talk about kind of the theme of that, but it's hard on our program to have time to really go into that human element. So it is linked on the website, thestateofus.org. So hopefully you'll read it and then excogitate and hopefully come away with some valuable insight after that, because I think it's telling.
And share your thoughts with us, because we want to know too. Are we picking out the right articles, or is this one that you found? In the old days of the newspaper, we call this a feature article. This is where there's been some investigative reporting done and a lot of interviews and a lot of quotes, not the information and the charts and graphs that Justin usually picks. This one's more storytelling. And so I think it's also something that you can enjoy reading because of the way it's written, but will also be very eye-opening. And if you're like me, you'll get very frustrated reading it and thinking, why are we putting people through this?
But hopefully that motivates you to talk to people in your life that you know, to get the information, right? And if you're out there and you're listening and you're not vaccinated, do what Lance suggested and talk to your local health district and talk to your local hospital. Because I think at the very beginning of all this, Lance, I kept telling people, and I think you did too, I hear so often people are like, well, I want to see what my doctor says about this. But for some reason, we have a lot of people not doing that on this. And if you haven't done that, please do. Please go talk to your doctor, your doctor, right? And see what they say and what they advise for you, because they know you, right? And they should be able to make, hopefully, a good recommendation. Their interest is in keeping you alive because, not to be cruel, I think most doctors are in it for the right reason, but they also need to make a living. And so they want to do what's ever going to keep you around so that they can keep making money. Because if you die, you're not very valuable to them dead, aside from, I think the reason most of them are in it is for the right reason, which is that they want to try to help people, right? So you've got two powerful things working together. They want to put food on the table and they want to help you. So hopefully they're going to make recommendations, you would think, that are in your best interest. So those are practical steps that we can all do, right? Call your local health district, talk to them, see what's going on, see what your local hospital is going through. Knowledge is power. And hopefully that's part of what we've done today, Lance, right?
Well, you used the word, you said, go get educated by your doctor. And that's what we're doing here on the show. At least that's our mission. And that is to educate people by providing honest, open, and respectful conversations. And I respect your opinions on the vaccine, but now we've been at this almost a year now. Go find out what the numbers are saying, because now it's different. A year ago at this time, we didn't know how safe the vaccine was or what problems it would cause. We've had almost a year with it now. So go find out the new information. Keep yourself educated. And if you've enjoyed today's show and you understand where we're coming from and you're talking to your coworkers or your family members and they like it, tell them, hey, you can listen to this show straight. You don't have to get it secondhand through me. You can go straight to the sources. And our show's found on Spotify, Overcast, Stitcher, Apple Podcast, and everywhere podcasts are found.
The State of Us is available Tuesdays and Thursdays as a podcast. We're also a radio program heard on the weekends on AM and FM talk radio stations around the United States. For the State of Us on True Chat, I think I got the victory today. I think I pulled it out 3-2.
You can have it. That's fine. I just want our listeners to know that I care about all of you, whether you're vaccinated or not. I just want you to be around to keep listening to the show for the next 10 years.
That's right. And there are steps that we can all take right now
to make sure we can all be here.
Exactly. Yep. That's the message. So for the State of Us on True Chat in Urbana, Ohio, in the county of Champaign, I'm Justin T. Wells.
I'm Lance Jackson.
Special thanks to Bradley Butch, our producer, and thank you, our audience, for tuning in. We'll see you next time. Be the change. Be sure to check out our website, thestateofus.org, for books, articles, and all the ways to tune in. thestateofus.org.